So I'm here with my beautiful patient and we're smiling. One of the reasons we're smiling is because we're very happy. And guess why? Because she's completed her full course of Accutane. We're very excited about that. And I asked if she wouldn't mind to share with people because people are afraid of Accutane. The parents are afraid of Accutane and they think it is a poison. You will get depressed, you'll lose your hair, your hormones will change, you won't be able to have children, blah, 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 all that kind of stuff. And fortunately, she trusted me because the technique that I'm using is very different and I've been using it since 2001 in a homeopathic way. And it's an integration of my approach to many things that I do in life, where I try to realize that it's not how fast you get there, but how well you achieve the final goal. And to achieve your final goal, if that is the main objective, you need to sometimes proceed slowly and see how your body responds to it.
Yes.
So if, let's say, you're trying to lose weight and you do it very, very fast, then you gain it. It's not a point. And the same thing with the Accutane. So what I found is if you do a low dose, and at first people would laugh at me. I was at conferences and ground rounds, and the chairmen don't want to name names, not to embarrass anyone, would say, "Oh, did you hear about that low dose?" And I'm like, quiet, maybe I'm stupid, I don't know this stuff, this guy is like famous all over the world and I'm suggesting it. And then in 2016 they actually asked me to present on the topic, and I was a keynote speaker in the cosmetic surgery meeting in Spain, and I told them about the treatment. And so what I wanted to hear is you, first of all, why did you decide to do Accutane?
Well, like you said, I was scared from the beginning. My mom didn't really support it, but nothing worked for me. Like, I tried the antibiotics, I tried the topicals, I tried a lot of things. It didn't seem to help me. I didn't see the results that I wanted to see. And you did suggest a really good plan for me, like low dose, which I wanted, because I didn't want to see those severe side effects. And the only side effect that I had was really dry lips and dry face, which I didn't mind because I had oily skin before. So it was fine. Like,
and that was because we also increased the dose, because at the beginning we didn't want to, but then we wanted to finish a little faster, so that's why we increased the dose. That's when you felt the dryness. So the dryness wasn't like a constant throughout the time. It's when we increased the dose, right?
Yeah.
Mm-hmm. Any depression, suicidal ideation,
No.
blood issues that we had,
No.
hair loss, anything like that? No. Wonderful. I'm trying to think, if you had an advice to people who are worried about the Accutane, what advice would you give them? How did you overcome that fear?
I just really wanted clear skin, and that was my goal. And I was like, this seemed like the last and final option for me, so I say do it. And it's not that bad, and low dose is good. It's way better than going on a high dose right away. So I say do it, and you'll get the results that you want.
And you have to do it with a good doctor. You have to follow it. Even it's kind of like giving someone a license to drive. You don't want to be reckless when you're driving. You still have to have the seatbelt. You still have to follow the laws in order not to get in accidents. It's not just about going slowly. Someone can still hit you if you go on a red light. It's not about just following the signs. You also have to have the seatbelt. So you still have to have a doctor and still have to do tests, blood tests occasionally and things like that. Some are afraid about the initial purging, when the acne gets worse when you start the Accutane. Did you have that?
Maybe yes, in the beginning it didn't work right away. Like, I didn't see what I wanted to see right away, and it took some time to be like, okay, I still have acne, but like have hope that it will go. I also tried the lasers during the treatment, and that helped a lot significantly.
So we also did some lasers.
So, yeah.
Yes, we did, yeah. So that's another thing to speed up the results, and also it can help marks and scars. And if you look at her skin, it looks perfect, and that doesn't. If she said that she had acne and she needed Accutane, people was like, no way. But it looks really perfect. A little bit red and dry. This is the weather right now. We're all a bit red and dry. And then the question is, what do you do afterwards? Because Accutane is the only thing available that can provide the cure, getting rid of your acne forever in about 80 to 90% of the time. And when you do low dose, I believe it's the higher rate of that. unless you have polycystic ovary disease or you have some other causes of continuous adrenal overproduction of the hormones that lead to the enlargement of your sebaceous glands. And unfortunately, you don't have that issue, so we're looking to cure. So the question is, what do you do now, and how do you maintain a skin that will not be dry and therefore age faster? And at the same time, not put any oils on your skin that will clog them and increase the risk of getting. I'm going to take that off because this background noise is probably going to be difficult for people to hear. So the answer to that is you need to find moisturizer that doesn't clog your pores. And one of the things that I find that would work well is a prescription medication. And I know physicians who will be hearing it will be unhappy with what I'm saying, but a lot of my nurses, when I used to work in Morristown, used clindamycin lotion as a moisturizer. Why? Because first of all, it does not clog your pores. Second of all, it's not too greasy. And third is, unless you use a benzoyl peroxide, the bacteria get resistant to it, so it will be working truly as a moisturizer after the first 3 months. But it will prevent other creams that you put on top from clogging the pores. So if you put the first layer of the clindamycin lotion, you don't have an allergy to it, right? Then the next layer that you'll put on top, whatever is the makeup or whatever, it will not clog the pores. Other things that you can use, and I've tried on myself, is some serums, if you're not allergic to them or irritated by them, or even massage oils, which sounds weird. Yeah. But I've done it on myself, and I specifically use a massage oil. I don't have any benefits when you can get on Amazon. It's a Tuscan massage oil. I like the smell a little bit, and I put it this morning on my face, even though I'm also prone for acne. I had acne, and I've taken a break for about a month. I'm giving my pills to my kids, but again, not supposed to do that stuff. But it's my kids. Don't share your medications. Anyway, but gosh, the secrets were revealed. But the idea is that I'm not getting the acne from that, and you can definitely do that, and it's good to actually do it all over the body. And when you do that, you want to put it on top of water. So when you wash your face right now, the best thing to do when you wash your face is not use hot water, because that very much degreases the skin. But actually use cold water. Cold water, okay. So I put the faucet in the morning on full cold, and I stick my face, feels like a little ice, one side, the other side, and then I take a little bit of massage oil on the wet hand, and I put it on the face. And that's very, very, I mean, I do it all over my entire body, but this is for the face. So not only it will help you stay younger, it will also help the skin from being over dried, wrinkled, and will not cause you any acne. So we're going to give you the prescription for clindamycin lotion. You can try that, and you can then try the massage oil and see which one you want. And probably it'll be easier for you not to have to require a prescription all the time, and then just to do that. But have that in case you get a pimple or two. So stress from either not sleeping, or from having an argument with someone, or from not going to the bathroom regularly, or changing your diet, or having a long flight, will cause the adrenal glands to produce more of the testosterone. And more of those hormones will lead to the enlargement of the glands. And that could lead to more oil production, which in some cases, if you scrub your skin or you have a clogged pores, could lead to oil being stagnant there, bacteria going in there, and a little pimple here and there. And then you can use that clindamycin lotion that you have. But otherwise, you should not have really acne in the area, and you will, I know some people will not like to hear that, the facials, but you really won't need a facial. As long as you take care of your skin well, and you don't put thick makeup stuff on clean skin. Put first a good moisturizer that does not clog, or massage oil, or the clindamycin lotion, and then that will be fine.
So my skin will stay dry from now on, or it won't go back to the oil that I had before?
It depends on you. It will not be very oily. It will be middle, so it will be good. It will not be dry. Right now it is a little bit because you're still on Accutane, and we even took a little bit more. You can see based on the lips. But the lips will soon return, probably in a month. So it's usually in a month. Now the other question is, when can you get pregnant? And the answer is depending on the dose that you were taking. Based on the dose that you're taking in a month, I mean, I'm not even planning to, but I'm saying for other people, in a month, if they want to, they can get pregnant.
And that's also for drinking, sorry to drinking
Alcohol you can even start now, so
Okay.
it's fine. Yeah.
Okay.
I mean, if you're fine to drink a lot, but if you take a little drink or something, it's fine.
Yeah.
The issue is your liver is metabolizing the alcohol and metabolizing the vitamin A, and it's kind of like traffic jam. So if like you're going on the highway and you have an easy pass, and on the easy pass you have someone without an easy pass, then they kind of cause a little traffic behind, but it depends how many cars are driving there. So if you're just gonna drink a little bit glass, a day even, which I'm sure you're not doing a day, but if you do a day, it would be fine.
Yeah.
But if you take a full bottle, or half a bottle, that it will be not as if you were not on Accutane for the first month. Again, so everything is for the first month. In terms of giving blood, the recommendation is 6 months, so I would stick with that. You don't want to donate blood just in case they give it to a pregnant woman. But otherwise, your skin will start returning in a month, your lips as well. And so it's good for you. It gives you enough time to get into a good daily habit of how to take care of your skin. The other thing is about sun. People are worried about sun. Did you have any issues with the sun?
No, not really. I put a lot of sunscreen on. It was fine.
Right, so you didn't get sunburn on your body even though you didn't put sunscreen there?
No, I tried to stay away from the sun.
Okay, fine. When you take low dose, you'll be getting a little easier tan. So but if you stay longer in the sun, you can get a little sunburn, even when you use a little sunblock. So people do have to be cautious with that. But in terms of you right now going in the sun, because of the low dose, you're fine.
Yeah.
Again, sunblock is always good to do no matter what. And that's about it. Vitamin A is really very important for many, many functions. And it's actually the #1 deficiency in the world. It's not any other vitamins. It's vitamin A. If you look in the world, that's the #1 deficiency. And you're taking a little dose for a long time, I believe would help with longevity, meaning living longer and reduce cancer. And a few years ago, it was proven that was right, that actually does increase longevity. And so there are many reasons why one can take it, but it could, as we said, put a little traffic on the liver, so your cholesterol, triglycerides can be increased, so you want to watch them. Mine are fine. I've been testing my cholesterol, triglycerides, because there are other things. There's food, there's other. You're not living in a vacuum, so you have to combine it. Think about it as if you're using other things as well. Any other questions?
And washing your face, the face wash, I use CeraVe right now.
So it's nice and gentle. Yeah, and you do it for makeup removal?
Just in the morning, just to
you didn't even need to do that. So you could have used. That's also why this. So any kind of face wash is still a form of detergent and exfoliant. And just plain water is enough, unless your face is in mud and you're trying to remove it, or you have a makeup that you're trying to remove. Which, by the way, another reason why you want the first layer to be a moisturizer or a massage oil, because then the makeup, when you do remove it, it doesn't remove with it some of your healthy cells, because it is a lot of trauma to the skin. And yes, you're young, and yes, your body can rejuvenate itself, but it's a good habit to get into, because as we get older, our body's ability to regenerate new skin is slowed down. And that's when they come to me and say, oh my God, why is it so itchy? Why is it so? Because it's crying. It's crying for help. You're just not understanding the language with what it means. So you don't need to even, and again, Sarah might be upset with me, but you don't need to use a cleanser. Just plain water is good enough.
I got it.
Any other questions?
I think we covered it. I think
Good,
so, yeah.
good. And if you have any questions, we're here.
Okay.
Thank you for sharing your experience. It was a pleasure. We'll miss you.
No, me too.
Thank you very much.